Everyone, I'd like to call to order the November 25th, 2025 Community Mental Health Full Board meeting. Please rise for the pledge. Next is the reading of the mission statement by Megan.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next is adoption of the agenda. I'll take a motion to adopt.
So moved.
Support.
Motion from Megan, support from Sharita. Comments, questions on the agenda? Seeing none, all in favor say aye. Aye. All opposed? Agenda is adopted. Now we'll move on to number 4, hearing of the public. Anybody from the public wishing to speak on anything on tonight's agenda has 5 minutes. You're welcome to come up to the podium, give us your name. Anybody from the public wishing to speak? Anybody from the public? Okay, seeing none, we'll close the first hearing of the public. There is one more before the end of the meeting. We'll move on to item 5 minutes. I'll take a motion to approve the CMH full board meeting minutes from October 22nd, 2025.
Support.
Motion from Jackie, support from Dana. Questions, changes to the minutes? Hearing and seeing none, all in favor say aye. Aye. All opposed? Minutes are adopted. Next, item 6, approval of standing committee meeting minutes. I will take a motion to approve the program and budget meeting minutes from November 12th, 2025, and the recipient rights advisory committee meeting from October 16th, 2025.
So moved. Support.
I hate to say this, we need more men on this board. You guys are killing me. There's, of course, you need to change the inflection of your voices. I'm going to go with Selena and Megan. Any comments or questions on the minutes? Hearing and seeing none, all in favor say aye. Aye. All opposed? Minutes are adopted. Thank you. I'll move on to number 7. I'll take a motion to approve items A through G as those were discussed at program and budget.
Support.
Motion from Lori, support from Jackie. Any further comments or questions on any of these items? Okay, hearing and seeing none. All in favor say aye. Aye. All opposed? Motion passes. We'll move on to item 7H. I'll take a motion to approve the HVAC expense in the amount not to exceed $28,000 for the west location. Motion from Megan, support from Donna. Tracy?
We had an unknown expense for HVAC.
Thank you. Comments or questions? Okay, hearing and seeing none. All in favor signify by saying aye. Aye. All opposed? Motion passes. We will move on to number 8, which is receive and file. We have no items there. 9 is resolutions. No resolutions tonight either. Item 10 is the voucher listings. I'll take a motion to pay the bills.
Support.
Motion from Sharita, support from Lori. Thank you. Comments or questions on the bills? Okay, hearing none. All in favor say aye. Aye. All opposed? Bills are paid. And with that, we're already on to the CEO update. Tracy?
Earlier this afternoon, you should have received the board update or the board report. I am going to highlight some of the items that are in there, but of course, as always, make sure to review that so you can get the details of the details. One of the first things is, as you guys know, we were excited to open the SUD Engagement Center last month. It all blends together for me. It feels more recent than that. But in that, we're very excited. We did have a large amount of media coverage and social media interaction. So there is a story, if you haven't got a chance to watch of it, several of you who were at the event are in the story. For WXYZ, that was also in the Macomb Daily, and it was also featured in the Macomb Chronicle. If you're not familiar with the Macomb Chronicle, it's that weekly newspaper that if you live in the Macomb area, you often get in your on your driveway. In addition to that, it was the most interaction in social media that we've ever had. The WXYZ posting, so their posting, I think had like last time I checked, which was like 2 weeks ago, like 2,600 likes. I want to say like 500 give or take shares, and then I want to say 90 give or take comments. And we actually also experienced similar, not quite those numbers, but I want to say over 700 likes in our own type of post and interaction. So we were pleasantly pleased. We were actually very excited about the positive reception of the community and kind of verifying what we already know, which is this is a large area of need. And a lot of the feedback, and I did have people reach out, was about it being an alternative solution that is just kind of accepting them where they're at that moment and kind of helping them move on to the things. And so that was a lot of the positive that was expressed. In addition to that, every time we do a full board meeting, we try to do board education. So Jackie has already heard this spiel, so jump in, Jackie, if I miss anything. But this particular month in the board report, you will find a feature on our FSS, or our Family Support Subsidy. So definitely read it. I'm going to highlight a few key things. You guys know I love a handout. I forgot to bring the handout, so it won't be as quality as I would like it to be, but I will bring them next month. When I say a handout, it's again attachment in your board report, so you can click on it, but it's that front and back kind of rat card that you could give out to the community. So if you're interested in that, you want me to bring a big stack, any of you, please let me know, and next time I'll definitely do that. So the Family Support Subsidy, and if you tried to summarize it, it's a financial incentive that somebody can receive. So it's in excess of $300. I don't remember the exact amount, $330, $340. Oh, so I was giving it more credit than it was there. But it is $1 a monthly figure that someone can receive if they have a child under the age of 18 in their home. They're allowed to receive the funding so they can purchase special services. If the child does have to be, we're the ones who actually do the eligibility. So we have a staff member. When someone comes to this and they fill out all the documents, they then work with the ISD, because the ISD has to verify that they either have a cognitive impairment, a severe multiple impairment, or an autism spectrum disorder. So if they're, again, under the age of 18, living in the home, there is an income threshold, but it's a little bit higher than other comparative programs. And if they do that, they get the funds, and then they use the funds to purchase whatever they need. And examples of things that they could purchase are additional therapies, special equipment, special food, diapers, transportation, in-home specialized care, respite care, family counseling, and support group access. Those are not all inclusive, just to be clear. Those are just some examples. I'm proud to say that Macomb actually has the largest number of individuals on FSS, and the reason why that's a proud thing is because the only way people know about it is if we market it and tell people it exists. Does that make sense? And in no way, shape, or form, I want to say Macomb, I'm going by memory, so don't hold me this exact figure, but I want to say it's around 400, where if you look at other cases, knowing Wayne, for example, in Oakland or larger communities, right, in theory, they would have a larger number, and they have a different, or at least Wayne, as a generality, have a lower socioeconomic status. So we do have this also on our website, so I'll share the materials. Please, I think as a board member, this is a great opportunity for you to know that if somebody needs that kind of that extra supplement or that extra thing, this is a great option for individuals and it is for a larger number of individuals, and it is unfortunately not very well known. There is like an annual certification because it is income-based. If, let's say, I got a new job and I'm making more money, it does affect. And if it's just like taxes, right? Like, in other words, if you do something, you can't go, well, I didn't know, they'll make you pay it back, just to kind of explain. So I'm happy to answer any questions on that if you guys, or I'm happy to bring lots of materials for anybody who's interested. The other few things I wanted to highlight is in your board update, there is some links for some legislative updates, including There's a current proposal for two things. There's lots of things that would impact us, but one of them that it seems like there's a little bit of controversy on is a bill to allow individuals while they're in school to receive medical services. So if you're not familiar with that, check that out. Some are thinking that, I'm just trying to summarize, some are in favor of it, some are not in favor of it. So definitely do that. There's also one for IPA. IPA is the tax that PHPs and MCOs or managed care organizations pay to offset, I'm trying to simplify this, Medicaid. So in other words, in an example, we get a set amount of money from the state, but then we have to take that same money and pay taxes, or AKA the IPA. And it's a way that then the state of Michigan gets credit for collecting those taxes, therefore allowing them to ultimately receive additional money from the federal government. So anybody who is aware of that, you're welcome to jump in, Tony or somebody, if I've not done it justice. But that is in simple terms what it is. So there is legislation or actions trying to get the federal government to allow that to continue, essentially, because the federal government in the one big beautiful bill said you can no longer do this. Michigan and any of the other, I think it was 12 or so states that also had somewhat of a similar approach. So they're trying to advocate with the federal government to say, allow us to continue to do this until we can kind of transition into a new solution. The other part is there is an update on the ISF, Internal Service Fund. The state of Michigan did advise us in our most recent submission of our, what we call our interim FSR, or our financial report, to simplify it. They said, you're incorrect again. It cannot be over 7.5. We have sent 3 written responses, including Corporation Counsel in the past, and they have not responded to them. Our stance is still that we will follow actuarially sound principles, which allows us to save in our ISF more than 7.5%. But they did say, what's interesting is they did say, you shouldn't do this, please resubmit your report and make sure it's 7.5%. But if in doing this, it's not late. If you remember last year, it was controversy about they arbitrarily said late, so now it's not late. The definition went back to a different definition is what it was. So we don't have intentions right now. We're just, again, communicating. We've communicated numerous times in writing. This is why we're doing this. We have actuarially sound. Recently, you guys reviewed the proposal to do the next audit to demonstrate that we have an actuarially sound ISF rate. I have great news, and Phil, you're welcome to jump into this. The county was able to finish their ACFR, AKA, I had to write this part down because I don't remember the full name of it. Annual Composite Financial Report, AKA ACFR, right? Because of that, that then allows us by the beginning of December to submit our currently overdue state financial report. It would still be considered late in theory, but it allows us to have one of our outstanding items completed. So we're excited about having that come off the outstanding items. The last item I will mention is in there. I drew your attention to it, and you already know this, but just in case you needed a friendly reminder, the next hearing date for the lawsuit of the 2 different locations that are suing MDHHS is on December the 8th and 9th. They're 2 all-day hearings. I know that we have some individuals attending. We don't know as of yet if it will be virtual. If it is going to be virtual, of course, Drew or the appropriate person will share it for anybody who is interested in attending. And that is all I have.
Thank you, Tracy. Are there any questions for Tracy about anything she mentioned? Okay. Moving on to other possible agenda items. We only have one meeting next month, which is going to be on Wednesday, December 17th here at 6 o'clock. You'll notice we didn't have a CFO update tonight. We will have one next month. And there's also a Recipient Rights Advisory Committee meeting Thursday, December 18th, 2025 at 8 a.m. at the administration office. And also just a quick note too, you noticed that, or you may have noticed that Tracy's contract was not on this full board. We have basically all the language buttoned up. It's just a technicality with HR in getting the pay scale placed into the contract, which should be done in the next week or so. So once that's done, that goes in the contract. Contract comes here on the 17th. We can keep Tracy for another 2 years. So, oh, you missed it. This contract is a 2-year contract.
Don't say it like that. She's like, 2 years?
I know. She might be a no in a couple weeks. Anything else from any board members? Okay, seeing none, we'll move on to item 13, provider comments. Any providers wishing to make any comments to the board? Okay. Close that. We'll move on to the hearing of the public. Anybody from the public wishing to speak? You have 5 minutes.
Oh gosh, I got a lot. No.
Go for it.
Hi, everybody. I'm Nancy, and I'm from Liberties, the director in Clinton Township. I haven't been here for a long time, so I'll try to make it short. We finally have a full board. In fact, we're getting ready to add one more person. So we have a full board finally. I've been there for 6 years, and we haven't had a full board, so I'm excited. I'm going back to March because I haven't been here in such a long time. On March 7th, we hosted a Veterans Coffee Hour with Diana Lasky. It went really well. We had several vets there. It was really, really nice. Crystal and Bev are now peer certified. A drop-in center, everybody is supposed to be peer certified. It's a peer-run drop-in center. So Crystal, I myself am one, but Crystal and Bev finally got peer certified trained. We had our carpets cleaned, which they needed it badly, and it's something that I wanted to bring up. Eventually, I would like to see a different floor in Liberties, and I got an estimate, and I've asked for help with some companies, but I haven't succeeded yet. But at any rate, I think it was like $12,000, and it's something that I wanted to ask the board if we could eventually get another floor, because the carpeting is continually, with the traffic, it's getting dirty quickly. I've kept the budget under budget $40,000 each year since I've been there, so it's just something that I would like you to consider. I've attended 3 CIT trainings, and we set a table up for Liberties at these trainings with other vendors, which is wonderful, to let them know what resources are out there. I've also shared my story with them 3 times, and it's a wonderful experience. And I'm really happy with the questions that the police officers are asking, or the attendees. It's so warming that we're all trying to get together and do something with our mental health. I'm going to share my story with a panel with Easter seals. I was just asked the other day, so I'm going to also share my story with them. We have ordered promotional materials in the last few months. Well, actually about 6 months ago, we ordered pens, backpacks, and magnets. We had nothing at Liberty, so we're really happy with that. Friday, May 2nd, we attended a resource fair at Carnes Community Center, hosted by Denise Menser, the state rep. And that was very interesting. In May, we also started the gardening project, which went really well. The state came out and was very happy with what we had. June 25th, Crossroads and Liberties went to the DIA, and it's a great experience. We're going back, I think, on the 12th of December to see all the projects that they had done. So that's really awesome. July, Crystal and I participated in dropping off the hands-off Medicaid book with 14,905 letters regarding Medicaid being cut. We dropped them off to John James' office. We participated in a roundtable discussion, or I did, with State Representative Denise Menser and the Attorney General, Dana Nessel. We did a Narcan training, which was provided by CMH. July 3rd, we did a field trip to Dodge Park. That was wonderful. We had like 14 participants, which was great. August, oh, I already went over that. We attended, of course, the MISD Health Fair, which is an awesome thing too. Bruce retired, you all know that. Our new liaison is Diana Ray and Libby Vucci. I'm sure you all know that. Sorry. September, we did a field trip to the Renaissance Festival, and there were 18 people that participated. On the 6th of September, we joined Swirly Top and did a fundraiser for the Veterans Home. And Liberty's had a table set up there. That was on a Saturday. On the 17th of September, we attended Walk a Mile, which is a great success. It's getting more and more people, which is awesome. I think we need to get more people involved in it, though. That's just my opinion. October 16th, we did a field trip on the Detroit Princess, which was wonderful. The members really enjoyed that. There were 18 participants. On the 30th, like I said, we did the DIA for a project that they're doing. The 17th annual community exhibition. So the members from Crossroads and Liberties did a craft or a project, and they're going to display them. So they're going back on the 12th of December. December 3rd, we are going to have a resource fair. It is International Day for Persons with Disabilities. So I am organizing a resource fair. Dorothy Pila from Doing Social Security will be there. Lori Doyle from For My Able. David Wilson from MyCare. Amy Hudson from Community First Health Centers. And Alyssa, the peer support, is going to be there to talk about peer support. And about the adult mobile unit. In February, I'm backing up a little bit just for some statistics. In February, we had 328 visits in the month from 64 members. In May, it went up to 428 visits from approximately 70 members. We average about 3 new members a week lately. Monday, we do meditation. We do 2 substance use meetings a week. We have pool tournaments, karaoke, bingo, and dinner on Fridays, and we're open till 6. We do free haircuts. When I started 6 years ago, there was approximately $12,000 in the account. We now are up to about $50,000, $60,000. We owe you guys $50,000, and the board has mentioned maybe we should start thinking about trying to pay that back. So I don't know who I would talk to, but I don't know, would it be Ken?
You could start with me.
Okay. All right.
Then we'll get you to the right people.
Okay. That sounds good, because that's something that we could do now. And that's all I have. I would like to see everybody come and visit Liberties if they've got time. Thank you, Tracy. And thank you, Donna, for touring it. but I'm really proud of Liberties, and I'm really happy with what Liberties has to offer our community. And I would like for yous to see it. So if you get a chance, please stop in. Any questions? I don't believe I'm still nervous doing this. And you're all such great people. Thank you.
Thank you so much. Anybody else from the public wishing to speak? Anybody else? All right, we'll close the second hearing of the public, and I'll take a motion to adjourn. Motion from Megan, support from Wayne. Perfect. All in favor? Aye. All opposed? We are adjourned. Have a good Thanksgiving, everybody.